Good afternoon, everyone, and welcome. My name is Karen Rice, and I'm the chair of the School of Social Work at Millersville University, and we welcome you to our third Policy Advocacy webinar session of this semester. We're going to continue our dialogue around access, and today's topic is access to employment. Just a little bit about the Learning Institute. At the Learning Institute, which is a committee comprised of faculty, staff, and students across Millersville University, we are dedicated to raising awareness, to increasing knowledge, and to enhancing skills that lead to the promotion of justice, advocacy, and activism. Before we begin, I just want to briefly remind you of some Zoom logistics. We're going to begin with our moderator facilitating a discussion with our panelists, and then following that, you will have an opportunity to pose questions directly to the panelist. At the bottom of your screen, you should be able to see a Q&A box. That's where you can pose your questions. I want to now introduce our moderator. Dr. Jennifer Frank is an assistant professor at the Millersville University School of Social Work. She is a licensed social worker in the Commonwealth of Pennsylvania, and her research and practice interests are in poverty and homelessness. Dr. Frank holds a PhD in social work from the Bryn Mawr College Graduate School of Social Work and Social Research. She has extensive practice experience in the areas of poverty and homelessness. She is active in her community and currently serves on the board of the Loft Community Partnership, which is a grassroots collaborative that seeks to attend to poverty within the Penn Manor School District. She is also on the board of the Hub, which operates the Campus Cupboard, a food pantry for college students. She also supervised the Food Recovery Network, which is a student club that seeks to attend to student hunger and eliminate food waste. She is an active member of Put People First PA, which is a local social advocacy coalition. Dr. Frank enjoys teaching across the curriculum. In the classroom, she enjoys creating an atmosphere of intense dialogue around pertinent and controversial issues of social welfare. A proponent of social justice, she seeks to engage students in broad thinking around issues at the macro level in order to create an environment conducive to social action and change. Welcome, Dr. Frank.
Thank you, Karen. Very cool. It's weird to hear your own information like that. And I'm like, wow, who did that? That was me? Okay, cool. So we have some really great panelists today. So I'd like to take some time to introduce them one by one. First, we have Jacob Hope. Jacob Hope is a member and leader of Put People First PA, a statewide grassroots organization fighting for healthcare as a human right in PA. PPF is organizing across the state, across all lines of division in Pennsylvania. PPF is building a national nonviolent Medicaid army to fight any cuts or hurdles to Medicaid, and is part of the National Poor People's Campaign. For his paid work, Jacob is a social worker at a federally qualified health center in Philadelphia, where he focuses on helping patients with Medicaid, Marketplace, and food stamps. So join me in welcoming Jacob Hope. Next, we have Melissa Baez, Chief Program Officer at Assets. Melissa has long known that her passion lies in creating social change through business and education. After experiencing life in Philadelphia and California, she knew Lancaster, where she calls home, was the place she wanted to focus on building a lasting impact. Melissa served as the Director of Programs for a college access program where her focus was designing and scaling offerings that cultivated opportunities to motivate and guide at-risk youth on a path towards attaining a degree in higher education. Now, as the Chief Program Officer at Assets, Melissa designs systems and offerings focused on community impact and business development, with a focus on building equitable entrepreneurial services that breaks down barriers for women and people of color. Beyond her personal experience, she continues to expand her personal connection with the local and global community. Not only does she volunteer her services in the greater Lancaster County as a guest educator, she is also a Global Shaper alum for the Lancaster Hub and a Cordis Fellow focusing on global social issues. Melissa sits on the board of directors for the Lancaster County Community Foundation and sits on the Diversity Committee for Girls on the Run. Melissa is a recent MBA recently completed her MBA in sustainability from Bard. So welcome, Melissa. Next, we have Dr. Victor DeSantis. Dr. DeSantis executes a proactive external affairs strategy that advances the university's mission and goals with industry and community partners, as well as elected and appointed officials at the local, state, and federal levels. He provides professional direction and oversight to the Office of Community Engagement, Governmental and Economic Development, and serves as a senior advisor to the president at Millersville University pertaining to all external and government activities. This position also serves as the university's right to know officer and as a member of the president's cabinet. So let's welcome Victor DeSantis. And finally, we have Patrick Clancy, President and CEO of Philadelphia Works Incorporated. Patrick Clancy, President and CEO at Philadelphia Works Incorporated, is the city's Workforce Development Board, possesses over 20 years of senior level experience developing and managing career and workforce development programs. He directs all aspects of the organization, providing strategic guidance for investments in solutions and services that increase opportunities for all Philadelphia residents, strengthening Philadelphia's local economy. Prior to leading Philadelphia Works, Mr. Clancy served as special advisor on employment and training programs for the Pennsylvania Department of Human Services. There, he managed the implementation of an $80 million welfare to work program across the Commonwealth, played an integral role in drafting the Workforce Innovation and Opportunity Act state plan for the U.S. Department of Labor, and advised the PA Secretary of Human Services on priority employment and training issues concerning temporary assistance for needy families, or TANF. In Mr. Clancy's 7 years as the Vice President of Training Programs with the former Philadelphia Workforce Development Corporation, he led strategic planning and development of 16 industry sector partnerships across Southern Pennsylvania, connecting employers, unions, and community colleges to create cost-effective training programs. Mr. Clancy holds a Bachelor of Science in Human Resources and Management from LaSalle University, a certificate in project management from Pennsylvania State University, and currently serves as a board member of the Wanamaker Institute of Industries and a trustee of the board for Community College of Philadelphia. He is a member of the Pennsylvania Workforce Development Corporation, National Association of Workforce Development Professionals, the Society for Human Resource Management, and the Workforce Development Council of the U.S. Conference of Mayors. So welcome, Mr. Clancy. So we have a great set of folks here for today, and clearly very capable of having a discussion about these really important issues. So we're talking today about barriers to employment. And as I prepared these questions, I thought about how we really can't talk about employment in a vacuum, as if it exists somehow separate from all of the context surrounding it. So the questions I prepared sort of start broad about society at large and get narrow into the specific barriers that individuals might face in regards to their employment. When we talk about employment, we're really talking about just social and economic well-being of families. And so my first question really deals with the issue of poverty, which is the broader issue that we're talking about. According to the Poor People's Campaign, there are approximately 140 million poor or low-income individuals in the United States. As a result of the pandemic, this group has seen additional losses in income, housing, and access to food and healthcare. Specifically in Pennsylvania, 10.6 million additional people became unemployed between February 2020 and July 2020. Additionally, about 50% of all poor or low-income households have lost income. In sum, the pandemic has further subjugated the economic stability of the poor. So I have two kind of related questions about this for the panelists. How might these events that we've all experienced over the past year become a backdrop for a renewed sense of urgency about the plight of those in or near poverty in the United States? And as a follow-up, what policies would you recommend to bolster and strengthen the social safety net for American families? So I don't know who wants to go ahead and take that, and then we can sort of share the air here.
I always believe ladies first, so. Sorry. Come on, Melissa, you can do it.
It's a tough one.
That's true, though. So, ladies first.
I appreciate that, and I'll take that as a generous,
Yes.
move there. So, it's a challenging question, especially with the lens of assets and being so involved in the Lancaster City community. We have seen we've seen the impact of the businesses shutting down, schools closing down, and the unstable homes, the lack of access to food, especially in the beginning aspects of COVID. It was extremely detrimental to our clients, our partners, our established businesses that we've worked with, and the ripple effect in that, not just on the individual household, but also the business community. And I could speak specifically about the impact of that and the work that we've done to help support those entrepreneurs, to support those families, but also addition to what Assets does and our social enterprise that we have, which is called Lancaster Works, which is a staffing agency. We were actually able to work together and do an initial outreach through the community to our stakeholders to find out what is the actual need and how can we be strategic about creating these safety nets for them, collaborating with the city, knowing that what we're doing is not enough. But it was a very interesting approach to be able to lead with understanding the need of the community before creating solutions. And in that, we started with the individuals who had the highest risk and being able to do outreach to them and trying to mitigate some of that loss, mitigate some of the risk there, and starting to bridge these opportunities with our employees who are going through the staffing agency, with the businesses that were able to stay open, but have, just a little bit of staff, the occupancy. And we really moved in that direction. And slowly, as the economy started to open up, we saw a little bit more success in that. But the effect of that is still, it is heartbreaking. I mean, you have to be completely honest about what that is doing to, especially in Lancaster City, the communities of color, and the impacts of them and their families. It's heartbreaking, and it has been.
Yeah, I would say we're similarly in Philadelphia. We're struggling. I mean, we have probably about 400,000 people in poverty. We have a surging rate of individuals that are food insecure, that unfortunately don't have housing that's coming to an end. And I would think one of the things that's frustrating on our end. So as a workforce board, we try to help people go back to work, right? We get money to invest in services and really try to make that connection back. So two things strike me in Philadelphia. One, this whole broadband for all, we got to start. Like, we just don't have access. Like, here we are in the city of Philadelphia with Comcast as our big towers and Verizon and AT&T, and we have communities that are not connected at all. And we are doing these small patch, sort of solutions, which is, we'll give you the Comcast Essentials, which is $9 a month. And that little blue thing just keeps zooming around. As Keston would, tell us earlier, if you get multiple people in your household trying to do, so all that to be said is broadband has got to be just like a utility. It's got to be at some point where the energy and the surge is the same, irrespective of where you live. That's one of the issues we're dealing with. The other one is the high school attainment rate. I think if there's anything we have seen right now is that the first wave of layoffs in the city, we had about 200,000 people apply for unemployment between March and June. 120,000 did not have a high school diploma. 70% of individuals who worked in our hospitality sector and our entertainment sector, hardworking people, right? They went to work and for whatever reason weren't able to get the high school diploma initially. And now we're faced with, how do we get people back in the labor market without a high school diploma? And I think there's some of the challenges we're working on, how to blend those models. But I'll pause there, and then I know others want to kind of chime in.
Yeah, I'd actually like to pick up on that because I think you make an important point about high school attainment. here in Lancaster County, the COVID pandemic crisis really has been so uneven across different employment sectors. And so, you make a great point about the food services, hospitality, and event industries, which are really core industries here in Lancaster County, which have been hit very hard. And even during this recovery period through the summer and into the fall, those specific industry sectors have not recovered. And yet you have other industry sectors like the professional and technical employees who have managed to switch to remote work and what have you. And in those sectors, there's been relatively little employment effects. And so you've got really a tale of different cities, right, so to speak, because the different sectors have been so divergently impacted by this. Even sectors that have come back, the healthcare sector and the retail sector, which lost a lot of jobs early but have come back. I think we're very worried here in the county about the new wave of COVID, and if there are new shutdowns, how will we accommodate those workers if those industries go back into any sort of a restrictive state? And so I think
yeah.
what we're really worried about is how different the impacts have been across these sectors.
So Victor, we're right in the middle of it right here in the city. And then I know I'll let Jacob jump in. The mayor just announced yesterday in the city of Philadelphia, no more indoor dining till January 1, right? So just when you thought we were making a little bit inroads back. But, our hospitality sector is what drives a lot of our entry level employment. And we are really trying to think, how do we really begin to help individuals? And, and that's the challenge here. I mean, you're right. For those that have an associate's degree or bachelor's degree or higher, able to pivot and work remotely, they've been fine for the most part. It's been the frontline workers of retail, hospitality, healthcare, home health aides, CNAs, nursing homes, really hard jobs. And with all schools now virtual in the city, we have single parents that can't go to work. I mean, they have to stay home and educate their children. And even that is unequal when it comes to the capacity of, families being able to log in the school district of Philadelphia. We're only about a 55% login rate. So we got communities of people, and young people in particular, that are just not learning at this point. Jacob, I'm sorry.
Yeah, I really appreciate the framing, right, that Jennifer gave. 140 million poor people in this country. And I've just been struck during this pandemic, right, that in thinking about the role of the state government, right, as we've seen, the federal government has dropped the ball. Right. And seeing the organization of other countries really reacting and using the state to actually take care of its populace, at least in a better way, right? So in a country I was just looking it up before the call, Vietnam has 1,300 coronavirus cases in total. And versus in the US, in Pennsylvania, we have more cases than that. We have hospitals closing, right? Hahnemann in Philly, St. Joseph's in Lancaster, UPMC, Sunbury, and others. So this was a moment the state could have taken over those hospitals, reopened them, provided jobs, right? The state and the city are providing housing for people. I think that's an opportunity for them to continue to do that more. But I think kind of the frustrations for us, I work at a fairly qualified health center, is I could sign up double the number of people in Medicaid. I could get 10 of my coworkers to do that. But when there's millions of people falling into poverty, what can we do as individuals, right, in that larger system? I think that's the frustration. So I think we need to also advocate for the state to do what it's supposed to do, which is take care of all of the residents of the state. While the rich, they're doing better than ever with their stocks, and where the rest of us, all of us on this call, are in the trenches. So yeah, I just want to also be like, what is the state's responsibility in all of this? You know, I think they should reopen all those closed hospitals, right? Lancaster City has one hospital now.
Yeah.
One
The
hospital
challenge
for
is,
the entirety of Lancaster City.
you know, Jacob, it's a good point. The state's sitting on $1 billion of CARES Act money. And they're sitting on it because they think at some magical moment, it's going to be able to be more flexible for them to pay other bills. And while we sit in sort of chaos here in the city and throughout the Commonwealth, where people really need food, they need access to healthcare, they don't have any capacity to, you know, have, you know, digital access. So I think part of this is how do we get local elected officials, county commissioners, or state representatives to be much more in tune with what, you know, people's lives are like.
Great. Okay, so let's go ahead and move right along. Talking about jobs. So one good job is my question. In 2015, the mayor of Lancaster City appointed a commission to combat poverty. So those of you from around here, you're probably familiar with that. Their collaboration produced a report called One Good Job. And I'll put a link in the chat after I'm done talking for folks if they want to look at that report called One Good Job as the outcome of this coalition. The report describes several domains of how to address poverty with the theme, the title of the report, One Good Job, finding that a good job is maybe a way to negotiate poverty. However, in 2018, Matthew Desmond, if you're familiar with the book Evicted, he's the author of the book Evicted, wrote a piece for the New York Times that discussed this idea and suggested that maybe one good job is just not enough in order to find your way out of poverty. So my question for you is, after review of these ideas, what are your ideas about these two pieces? Is one good job a route out of poverty? Why or why not? What do you think about that?
So I would say it depends on, you know, where you live and the wage, right? So one good job in Philadelphia County, like you have to make probably $25, $30 an hour for a family of one or two to be out of poverty. That is nowhere near what a lot of our customers are making. So one good job, I think in theory, we would love to see, but I think in reality, what we see is people have to have two jobs. The problem with that is then there's really little time, if any, to reskill, right? So how do you ever get out from under if you're constantly running from one job to another? So we're not seeing it, and we're frustrated because, yeah, are there jobs available in the city? Absolutely. You want to work in a warehouse? Man, we got thousands of openings. But the reality with that is you're not going to make enough long-term sustainable to get yourself out of poverty. So we have to have a better education strategy at a younger age and middle school and high school, and really focus in on how do we begin to bring in business that is not just entry-level wage. I mean, I think that was one of our challenges, is we built our economy a little bit around hospitality and entertainment. And what we're finding is a lot of those jobs didn't pay enough. And now when those individuals are laid off, now what? Like, we don't have another level of employment per se to put individuals in.
I think one of the aspects of One Good Job that I admired is that they're not just proposing that the way out of poverty is having a livable wage, and that's it. The concept behind this is more of a systemic change and systems change, that you are working at a job that provides livable wages, but there are other partnered strategic organizations that are supporting an individual through that system, providing mental health, providing affordable housing, providing accessible food. You're not living in a food desert. That there are other supportive systems that are making sure that these individuals living in poverty are lifting themselves out, but still feeling empowered by having a functional, productive role in society. And yeah, I mean, if you're just dependent on one job, it's at that income level, in today's society, it's definitely not going to work. That hence why you have so many individuals living in poverty, working 2 or 3 jobs, not able to completely invest in their kids and their education. And you see the long-term systemic impact of that long-term. So I think the initiative of One Good Job did an excellent job of incorporating this aspect that it takes a village. It takes a community to lift individuals out of poverty. And that's the organization that I work for at Assets. We actually aligned our values to that. And we made sure that any initiative that we're doing, our goals internally, the programs, all the activities and the impact that we were building inside aligned with some aspect of the goals that were involved in this report. And that we communicated with other organizations and made sure that they knew that we were a support system for any individual that they might be working with. So in turn, it turned into this beautiful network of individuals and organizations working together to really understand what it takes as a community to lift up, which I wish this would have put Lancaster on the map, because this initiative kicked off an amazing like local community ecosystem to really work towards alleviating poverty within the 15 years that they had planned. And I really do hope that we come back to it and we see, well, where are we at? Where are we at? Because I mean, you could write this report and it sounds great, and you have organizations that are aligning to it in order to make moves to alleviate poverty. But if there's no check-ins over time, like the 15 years, where are we at 10 years into this? Where are we at closer to 15, just for accountability purposes? But I do love the concept of it, and I think it aligns with systems change.
Jennifer, I'm a really big fan of Melissa's organization, and I think they do great work. And let me tell you, I'm a big fan of that report as well. But and I like the same thing Melissa liked, which is the very holistic approach with the labor market participant in the center, with wraparound services that support that. I want to take it one step further though and talk about not only that as a cross-sectional time-bound piece, but then a cross-career, because for me, the way to take that forward is not just one good job, but one good career, so to speak. Because what we need to be able to look at going forward is not only the sustainability of that job specifically, but that person through the labor force. Because we know that that person probably won't stick with that one good job, but then needs to upskill and reskill so that while they're in that one good job, they're also looking future as to where does their career go next.
Right.
The sustainability of that person, of that labor market participant and their family unit, that sustainability is predicated not only on what they're doing today, but where they are 5 and 10 years down the road. So the more that we can continue to invest in a lot of the work of job training, job skilling and upskilling, the more that we're going to ensure that that person not only has that one good job today, but then also navigates their way into one better job tomorrow and an even better job the next day.
I think that's an interesting thing, Victor, like a paradigm shift. Instead of focusing on the job, we're focusing on the person and their livelihood and their life. And that's a societal narrative change, really. So I appreciate that's a good comment.
Mm-hmm.
Yeah, and I just wanted to expand it a little bit too, right? And like in the US, we don't have housing guaranteed as a right. We don't have healthcare guaranteed as a human right, food.
Mm-hmm.
So workers, people are at an extreme disadvantage when they're trying to find work, because you need to feed your family, you need to have a roof over your head, right? So those things are all connected. In my experience, I'm seeing more and more and more people in the quote gig economy. So what is work looking like today? It's not these so-called like careers. Like, what is a career if you're an Uber driver? What does that mean? You know, it's not like for my nonna who didn't have a high school diploma but got a good union job as an AT&T operator for 40 years, you know, that doesn't exist anymore. I don't know if that will exist again, right? For a lot of macroeconomic reasons, which we won't go into, but I think if we want to give people, individuals or communities, like an equal playing field or a leg up at least in trying to find work, because there's a lot of work to be done, but apparently not jobs that'll pay you a living wage to do it. We have to guarantee housing, we have to guarantee healthcare, we have to guarantee all these things so that people can do these things that we're talking about, like working a job. Yeah.
Absolutely. We'll get to those things for sure, Jacob. I appreciate you bringing that up. So let's just start there and talk about livable wages. So most of you noted, you know, about a livable wage. A livable wage in Pennsylvania, by the way, is probably over $24 an hour. Okay, so that's where we're at. The minimum wage in Pennsylvania is $7.25. I always survey my students who knows the minimum wage. And of course, like they definitely know, right? Because they've been there, right? This is the same as the federal minimum wage. Some states have chosen to increase the minimum wage, but Pennsylvania was not one of them. The myth is that minimum wage workers are teenagers who simply need to learn a good work ethic and increase their spending money. However, data demonstrate that minimum wage workers tend more likely to be household wage earners that are supporting dependent children. Further, the minimum wage has not been raised despite decades of increases in productivity. So this is kind of a hot topic. It's a good one to kind of prep us for Thanksgiving dinner, right? When we talk to our families about this. But what do you see as the benefits and drawbacks of raising the minimum wage? Why is there so much pushback and negative rhetoric around this discussion, despite the fact that the purchasing power of minimum wage is seriously not livable? Let's go there.
So I'll go. So I'm sorry, Melissa, it looked like you were going to go again. So ladies
Well,
first.
so when I think about this question and I think about livable wages, this might not answer your question directly, but if we look at what's happened in COVID with the unemployment and then the impacts of unemployment, where people are depending on that and choosing not to go back to work. I mean, can we just talk about why people are depending on that check? Like, to me, what that exposed to of our entire country is that people are not getting paid enough. If you have someone that is willing to not have a consistent job because their unemployment check feeds their family more than their paycheck, that is a problem. And like, what does that say about our country? What does that say about our practices? What does that say about the value of human capital within the work environment? It raises a lot of questions and something that we've been sitting on. And to your point, like drawbacks, I don't know, benefits, people are happier. People are willing to commit and be loyal to your job, and they're willing to be consistent. And if you think about human capital, if they are happy, if their well-being is taken care of and they're satisfied, the loyalty and the commitment to the work and productivity, I mean, it's there and it is fact. And that's where I stand. And I just think if we were to explore that a little bit more and we could see the impact of that, especially rooted out of COVID, it is 100% clear.
So I'll be happy to actually peel on that one because we're closely aligned with the unemployment system and how this impacts. So what we've seen when people got the extra federal bump, right? So the state minimum is not life sustaining. But when you added in the $800 or $600 extra a week, then it became sustainable. And that's when people decided, you know what, I'm not going back to work because I'm getting 600 from the federal government and I'm getting maybe 500 from the state government. So now all of a sudden I'm making $1,100 a week in the early parts. And it wasn't until that incentive of federal money went and you had to now go back to just your state amount that people began to get a little bit like, uh-oh. And so if they don't pass another stimulus, everybody's waiting on the stimulus too, by the way. So as we talk to workers and we talk to businesses, you're absolutely right. If people were paid an equitable wage, they would go to work, right? And for those that pay less than $13, $15 an hour, they're going to have high turnover. And they're going to have high turnover because people don't feel valued at that wage. So, you know, it would seem to me that, you know, we're hoping that more businesses understand that there's more pros to a $15 an hour minimum than there are cons. And for those that, you know, the chambers that say, you know, the cons or, you know, they won't be able to have as many people. I just don't think they understand the data that Dr. Frank was putting up there. So I would think that as we get closer to another stimulus package, we're a little bit worried again because people may get that same sort of federal addition, which is needed for them. But then that may also not put people back on the path of looking at employment. I think what we miss here, unfortunately, is the time to upskill people during this time, right? So while people are still trying to think through, do I go to work or not go to work because of the, you know, subsidies? we should be trying to find more creative ways to help people gain additional skills while they're sort of in this sort of holding pattern.
I'll jump in too. Am I allowed to answer my own question? Probably not. Right?
Sure.
No, absolutely.
It's like we forget that when money gets put in the hands of the uber rich, it stays there because they don't have to spend all their money. But when money gets in the hands of the lower income folks, ourselves included, we need to pay our bills. We have to spend it. And when those dollars go out of our pockets and into the community, it's stimulating economic growth. So we
Right.
forget, it'll go through right to the economy.
Absolutely. And one of the things that we need to keep in mind right now in the midst of this conversation about the livable wage and the minimum wage is the transactional costs of going to work. And there are transactional costs. There are substantial barriers, not only costs, but also access costs to childcare right now across our region and across this country. There are, and now in an environment where there have been transportation access issues, public transportation most particularly. Now you're in an environment where people actually don't want to use public transportation, even if they have to. And so there are some barriers right now to getting people back into those positions. But I absolutely support the notion that we need to have a very targeted federal and state approach to stimulus. And it needs to be targeted in such a way that it's going to hit those people that most need it. The broad scale, let's send everybody a check for $1,200 approach up to a rather high limit. I think we need something far more tactical that really impacts the folks that need it the most, that are in the lower scale pay ranges, that are most shut out of this current economy, with transaction costs that are high in many respects.
Yeah, that's right. And I just want to add, I think one of the elephants in the room with the wage is that there's people who benefit from paying the low wage system, right? Like we have to say that, like there's a group of people who make a lot of money and they benefit from paying their workers less money, right? And also their workers being more precarious because then they can replace them with other people, right? So like we should say that. And I guess just secondly, that like $15 an hour sounded radical. I don't know how long ago it was, 5 years ago, but as Jennifer was saying, still isn't a living wage, right? So what actually do people need to live, and let alone support their families? But yeah, I'll just add that.
So I've got a couple more questions here about some of the smaller aspects. So we'll talk a little bit about housing, healthcare, transportation, childcare, if we get to it. As we're doing that though, if you have a question, folks that are listening on, if you want to go to the bottom of your screen where it says Q&A and type your questions in there so that we can kind of see the questions that are coming in. Some folks are putting them in the chat, which is okay. But if you want to go in the Q&A box and put your questions there, that would be best. And I'll keep my eye on that as we keep moving through these questions. The next one is near and dear to my heart, related to housing. Okay, so we can't just talk about jobs and employment without talking about all of these contexts. So thinking about housing, there's no state in the United States where a minimum wage worker can afford rental housing without finding themselves terribly housing cost burden, paying way more than 30, 50, 75% of their income towards rent. In 2017, the National Low-Income Housing Coalition determined that the national housing wage is $21.21 an hour for a 2-bedroom unit and $17.14 an hour for a 1-bedroom unit. They found that there is not one state or metropolitan area in the United States where a full-time minimum wage earner could afford a modest 2-bedroom apartment. So no state, no metropolitan area where this is possible. How can employers and communities come to the table to address these affordability concerns in a systemic and just manner? Housing.
I want to give the example of strategic partnerships, especially in Lancaster, that has been doing a really great job of doing this. And this is a partnership between two dudes, painting company, who is a certified B Corp. working in partnership with LHOP. And this is a for-profit business. This is an employer who looked at his employees and understood that I need to take care of who is taking care of me. And I want to make sure that they are leaving my business and going home to a safe and sound place, but also that they are looking at their employees and trying to provide a path forward for them, making sure that they are sustaining their life and having more of like this career. I know, Victor, you were kind of talking about this systemic change of getting them out of poverty and having more ownership. And what they've done is they partnered up with LHOP, and they were able to work with their employees and get them affordable housing and create this individualized program for their employees to be able to own their own home after a certain amount of years. And a portion of their paycheck was able to go towards some of the payment of the home. And I'm thinking about the creativity that employers are able to take on individually to help this process. And I admire that, because it's not that you're just a B Corp and you're it's part of your values. It's just you're thinking beyond that, and you're thinking about how this could be a model example for other businesses to see that this is okay, that this is a way that we could do business differently and take care of our employees differently. And they're doing such an amazing job. And it's just a great partnership that they have with other organizations in our community that are focused on affordable housing.
Housing is a good news, bad news story, as well as so many other things in this economy right now. In some respects, we've got we had a housing industry that collapsed back in April or so. Not only was construction impacted, new construction impacted, but also the resale market was impacted negatively. And so, on a positive note, we have seen strong growth in home sales, and so existing home sales are absolutely through the roof right now in terms of housing turnover. New housing starts, several pockets of new housing starts in this region are hitting 10-year highs in terms of new housing starts. Mm-hmm. The bad news of that story is it's not really helping the people that we're talking about here today. We're not talking about new housing starts in the affordable markets. Yeah, there's a couple of great projects going on locally and regionally, but across the Commonwealth, across the entire environment that we're looking at, the housing market boom right now, that the resurgence that we're seeing is really aimed at the middle and top tiers of the marketplace, and not really at helping those folks that need that affordable first time experience. Those are the folks that are being left out, particularly in Lancaster County, as prices now are escalating at a very rapid rate. Who are you leaving out of that price escalation? Those people that most need the help.
Yeah, I got nothing. I think you're absolutely right. I mean, I think part of it is that we're frustrated in the city because we have neighborhoods that are gentrifying like crazy. Right. You thought you could afford your row home at 30, 40,000. Now all of a sudden someone buys it and they sell it for 250,000. And we wonder why we have, unrest. So I think this is a conversation that needs to go much longer and wider. I love Melissa's example. I mean, I think if we were so fortunate to have more businesses behave like that value people, that actually care about them, that they'll have people stay with them forever, right? I mean, that retention rate is going to be extremely high, and at the long run, really benefit their company. Unfortunately, we're just not there yet in the city. I think we're struggling just to find, affordable apartments, as Dr. Frank mentioned earlier.
In Lancaster too, it's this issue of gentrification and people being massively priced out of their neighborhood.
Yeah.
Yeah.
Before we go to Jacob, his last name is Hope, so we're hoping he gives us good news. Jacob, what do you got?
I mean, listen, like I said this before, but housing isn't a guaranteed right for people in this country. So that's just the reality. The federal government has for decades, I'm young, so I haven't seen this as much personally, but has just like cut funding for public housing for decades, right? So we're taught about these horrible like housing projects. They're so terrible. Well, they're falling apart because there's no money to fix them up. Here in Philly, the PHA is privatizing and selling off public housing, and then doing mixed income housing. So they'll tear down a tower with a couple hundred units and replace it with like 40 units. So, you know, like those are structural issues. So individuals are stuck in that. And if, like, I appreciate what everyone else has said, right? There's lots of housing and stuff for middle and higher wage earners, but what about the working class, right? And I think the homeless union, the National Homeless Union, has a good quote, which is, many of us are only one paycheck away from being homeless, right? So I think that's just another angle to this, right? Which is that once the protections are gone for these eviction moratoriums, we're going to see waves of homelessness, which we have. I've seen this in my communities that I work in the health center, and you have an abandoned house right next to someone living in a tent. So clearly there's houses, right? And there's land in Philadelphia, especially, but I think, Lancaster as well, these post-industrial cities and small towns like Johnstown, Altoona, other places. But the priority of the funding by the state or the federal government just isn't to give people housing.
I think that's a good point too. It's always been about more than just the issue at hand, right? It's like, why would you have a homeless person in an abandoned house? Because there's something else going on. And I think this speaks to, Jacob, you've mentioned about what is a human right. So let's do one more question here about that as it pertains to healthcare. So in the United States, healthcare has been connected to employment. And we probably, are well aware of that, right? You have healthcare with your job. And this practice began after World War II to entice workers into job opportunities when raising the wage was not an available option for employers. These practices have continued and are profoundly embedded in the way that we think about employment. In fact, many people stay in employment for the sake of retaining their healthcare benefits. Can you speak to the connection of healthcare to employment? So if people are losing their jobs, they are losing their healthcare. Okay, so let's talk about that a little bit. What benefits do you see in detaching healthcare from employment status and instead attaching it to that person's humanity? In other words, should healthcare be seen as an employment benefit or as a human right?
I mean, I would think it should move to a human right. I mean, I think when we look at the gig workers, as Victor mentioned earlier, I mean, there are individuals without healthcare. Anybody that's a 1099 or a gig worker, they don't have, sometimes they have to make decisions to go work someplace they don't want to work just because of healthcare. And I think as we look at people's mobility around business to business, my dad worked at a refinery for 38 years. That's never going to happen again with a pension and health insurance. So, I mean, I just think we need to start thinking through how more and more that people don't politicize it. Though. I mean, I think that's become part of the challenge is that everybody thinks because we believe, or I believe, that humans should have access to fair housing and medical coverage, that all of a sudden, I'm part of a political party that doesn't understand. And I think we've let some of these bigger issues get politicized when it really is a basic human right.
I also, well, when we think about small businesses in the United States, so about 25% of the small businesses since COVID have either shut down completely or have temporarily shut down. And if you're looking at small business in the United States, they employ about 47% of the US workforce. And if we're going to think about the impact of losing healthcare, especially due to COVID, and people are dependent on that, it is detrimental to our society. And I mean, Jacob and Patrick, I am a true believer that it should be a human right. It should be accessible and affordable to all. Healthcare is not something that you should be waking up and having to fear not being able to access medication, doctor's appointment for your kids. It's just, mind-boggling. Like that is hierarchy of needs. That should be taken care of. Like people should be focused about being productive in our community, not about whether or not they can make it healthy for another day or two. It's
Then it becomes a job retention thing, right? So for us
oh my God.
at Philadelphia Works, we can pick up like 80% of the cost of healthcare. But if you have another organization that could pick up 90% of the cost or 100% of the cost, then all of a sudden you're not competitive anymore and you're not going to get the best. But should that be the case? Should I lose out because, we are stretched with, like we all are stretched with budgets that we just can no longer accommodate that. And when you get into family care, then you really got yourself a large investment to make.
It's so difficult for small businesses to even get to the point of sustainability to be able to offer healthcare
Yeah.
for their employees. Can we talk about that?
I know.
It is
That's why they stay under a certain threshold of hours, right? Because
exactly.
they,
It's
the
so
law
difficult.
kicks in. So all of a sudden everybody's at 19 hours or 29 hours or, whatever the number is, it's always 1 hour under.
Mhm.
And that's a challenge. I mean, and when we don't have young people getting proper care, then we start the whole generation of problems again, right? If we don't get families or adults to proper care, at some point they're not able to be productive workers or students or even be able to have what we all consider a family of well-rounded, happy people. It becomes a real challenge.
Absolutely. And what started as a policy set a precedent, and now we need to rethink that, I think, because we have all these unintended effects. So I have a question in the chat. I had some questions here also about transportation and childcare, thinking about barriers.
Yeah.
But I have a question in the chat. Do you think educational programs such as certifications and training programs might be an effective intervention in response to increasing unemployment, particularly for vulnerable populations?
So that's right up my wheelhouse. That's what we invest in. So I would say yes, if we have all the right wraparound support, right? So I think it goes back to we can get people certifications, right? And they can be really good at that. However, if they don't have family supports or if they don't have other ways of getting them to the job and back. So the biggest challenge we have, which is mind-boggling, is that I could pay for the education for somebody to get a certification. The minute they get a job, I can't pay for them to get to that first 2 weeks of employment until they get their first check. So here we are, we've invested all this public money and my rules don't allow me to pay just a little bit more to allow somebody to get to work until they get their first check. So you finally finish it, you finally get across the finish line and all of a sudden now we don't have the wherewithal allowable. So we're trying to raise other monies to help pay for some of that. So certifications is a way, as long as it's stackable in a career pathway. And that's the other part that we're really cognizant of, that if we're going to put adults back into training, it has to be valuable. It can no longer just be, let's hope they get a job. We better have done our research to make sure it really is what's in our economy right now.
Absolutely, and having those conversations with the industries, I think is
Yeah.
so important in that regard. An important ingredient in this is not only understanding what the needs of those potential workers are who we're trying to upskill with badges and other kind of new portable credentials, but it's also ensuring that they're linked directly to the skills that the industries are looking for specifically, and having those relationships set up. And I know the workforce investment boards and the workforce development boards are really good at this, but having those relationships set up so that there is that direct pipeline. Right now, we are in a time where the degree, the degree is which for forever has been part and parcel, the credential of choice. The degree is still important, but the portability of stackable credentials, of shorter format credentials, is on the rise. And I think we have to recognize that in this virtual world that we're in with virtual learning and so many different providers, there is an increasing milieu of different credentials that can support the workforce. But it's ensuring that those credentials are the desired credentials by that industry cluster that they want to get to.
The other thing I would add, Victor, is that credential has got to lead to credits to keep people moving, right? So I'm a trustee of the Community College of Philadelphia, and one of the things we're working on is we have a workforce division, right, that works on credentials. But those credentials have got to enable people still to go back and get their associate's degree, right? Or have that equal something that keeps them, because lifelong learning is in front of us. I'm blessed to have a 24-year-old who went to college and graduated. I have a 21-year-old who's graduating in May, and I have a 17-year-old ready to go somewhere, maybe, because she doesn't know what she wants to do. But all that to be said, this lifelong learning model is important. So when people are going for credentials, we should make sure that they have the capacity to make that portable enough to be of a value. And I think the industry piece is important. I'll give you one example, then I'll jump. So we were talking to a lot of insurance companies. They needed people to draw blood, phlebotomists. They say, yeah, it'd be great to have a phlebotomist, but if they don't have a driver's license, forget it. We don't want them because we need them to be portable and ready to go to the next place and the next place. So it's one thing to get the certification, but if you don't do the full wraparound, then you're not going to be as successful.
Absolutely.
So we're short on time. We got a couple minutes, and I have one question here that sounds like a really good wrap-up question. So let's let everybody can have a chance at this one. What do you think are the immediate focus areas where we should really spend our attention in terms of responding to these issues facing families and employment? What are the immediate focus areas? What would you recommend immediate?
So I would say, access to relevant tools, right? Access to the internet, access to digital learning. We're doing a pilot project in the city around digital navigators that go into people's houses and set them up like they were, like if you were getting a brand new laptop yourself in your house. So, getting people the proper tools now and not just waiting for people to maybe get access, because we're moving to a totally digital world. And if we don't start to educate people digital literacy, we're just going to keep them poor.
Yeah, I think I would go two ways. One, I would say right now in the most, in the short term, the next few months, we need to see an infusion of supports for families and for individuals who are left out of this economy right now, and who may be impacted by this, whether we call it a second or third wave. When we start closing down and restricting more access to business, as Mr. Clancy talked about already, I think we have to provide that level of support, and that can't come soon enough. That's got to come. Literally, it's got to come now, between now and the holiday. We cannot get to January 1st without a stimulus package that is specifically aimed at those folks that need it the most.
Right. Stop the political nonsense.
Go ahead, Jacob.
Yeah, I mean, I'm just thinking about, I'm thinking big. I'm thinking about how, again, the federal government, we're sitting here waiting for the federal government, but the state government also can do plenty of things. And put people first, we've been calling for the governor to expand Medicaid, but to everyone in Pennsylvania. So he has the power to do that. He could apply for a federal waiver to do that. He hasn't. He could use emergency powers to reopen these closed hospitals that I listed: Hahnemann, St. Joseph's, UPMC, Sunbury. There's jobs for people right there. There's also all kinds of things that they could do with those hospitals, right? In Philly, a couple of blocks away, they instead had a field hospital in a basketball stadium, right? So even though there's a perfectly good hospital owned by a really evil person named Joel Friedman, they were getting extorted from, the governor could seize the hospital from him, right? They have the power to do that. So yeah, I think they could do those kind of big things. And also I appreciate the things that people are talking about, these more granular specific things, because those are important too.
And I'm looking at two specific things. I'm thinking about our educational system, and I'm thinking about creative financing for our small business and large business who employ most of these individuals. And how can we be, one, more creative with the capital that's being provided to these small businesses? One of the biggest issues that we had in times of COVID was these emergency funds were very complex. The process was insane. And so many people of color, small businesses who were startups could not figure out how to apply. And it was a huge barrier, and they missed out on PPP. They missed out on EIDL because they couldn't reach these requirements. It was insane. But what I loved about Lancaster, and here's a huge plug, Lancaster in the state of Pennsylvania did an amazing job of providing these additional funds, grants for the small businesses, and made them more accessible. The city did it, the county did it, and the state did it. It was incredible, and a great model for other organizations to take on. But I'm also looking at our education system and the challenges that our teachers are going through, the safety of the kids in the household, and how can we be more supportive? And Pat, I mean, this is basic needs for those families that had to completely shift their entire lifestyle.
Yep.
And how can we be better at distributing resources to those specific individuals in need? Crisis mode, especially. It's just, to me, those are the two really big, important things, especially that sit close to my heart. Mhm.
I would say down the road, education, we have to think of it better.
Oh my gosh.
Like we are at a crisis here where we've lost time. You know, this idea that school isn't longer, you know, I know that's not a real positive, you know, popular thing with the teachers union, but at some point we've lost time. We've lost, especially for people of color, we've lost too many months of people not having access to quality education, especially at a young age.
And the ripple effect of this.
Yes, it's
to
long
come.
term. And how do we ever get out of this
Mhm,
mess?
mhm.
Which has been delightful to talk to, by the way. So thank you for inviting me.
So this has been a wonderful discussion, and we could probably go on for the rest of the afternoon, but I realize we said an hour and we want to be respectful of your time. But I want to, thank all of our panelists again. Thank Dr. Frank for moderating our session on access to employment. Dr. Frank has been updating the chat to provide resources to all of you. We will compile that, and you can expect an email from our graduate assistant, Shana Landis, who will be sending out an email to everybody who has attended, providing you some, not only these resources, but some other ideas of ways in which you can get involved within your own communities and your workplaces, as well as to complete a survey for us as well, because we value and appreciate your feedback. So again, I want to thank our panelists and Dr. Frank for leading us in an engaging, enlightening discussion today.
Thank you
Take
for
care,
having me.
everybody.
Thank you.
Thank you.
Have a great day.
Thank you.
Everybody. Take care.